Good afternoon. Thank you so much for joining us today for a discussion on why North Carolina must expand Medicaid and to cover all low-income people right now. I'm Kiger, Chief Operations Officer with Pisgah Legal Services. Today, we will focus on the health and the economic crises that are a result of the COVID-19 pandemic, and we'll inform you of how Pisgah Legal Services is advocating for policies that will both protect and support low-income Western North Carolinians as we face this unprecedented moment. I am incredibly grateful to be joined here today by Senator Terry Van Dyne, who will provide us with up-to-date information on what is happening at the North Carolina General Assembly. Senator Van Dyne has been a member of the North Carolina Senate since 2014, and she represents District 49. She is a tireless and a strong advocate for healthcare rights. Now, as we get started in our conversation today, I'd like to give you all a very quick preview of how we'll run this conversation, because Terry and I are in two different places right now. I'll start us off with a bit of an overview of what Medicaid expansion is, who it would impact, and why it is so critically important right now for people who are experiencing poverty. Then we'll move over to Senator Van Dyne, and she will give us updates and her perspective. And then finally, I'll wrap up our conversation with several key aspects of why this is such a critical advocacy effort for Pisgah Legal and action steps for everyone to take. So as I begin, I want to start by saying that I hope everyone who's watching this now or later, that you're able to keep health and to stay safe right now. This is a difficult time. And it is during this time that many of us are looking for ways to join together. And one of those ways that we can join together and to advocate for others is to fight for quality, affordable healthcare coverage for everyone. We at Pisgah Legal Services believe that healthcare is a basic human right. And we are seeing now how healthcare for some affects all of us. So that leads me into the very first question that we want to discuss today. And that is, what exactly is Medicaid expansion? Simply put, Medicaid expansion makes Medicaid coverage available to all low-income people here in North Carolina. Now, I often get this follow-up question, well, isn't that what Medicaid already does? I thought Medicaid covered all low-income people. And unfortunately, the answer is no. It does not cover everyone who is experiencing poverty, particularly low-income adults. Under our current laws here in North Carolina, Medicaid covers only a small portion of extremely low-income adults because of these very restrictive eligibility rules. For adults who don't have children in the household or are not considered disabled by Social Security standards, they may be very low income, and yet they do not qualify for Medicaid. So here's an example. If we talked about a single part-time worker who makes under $10,000 annually, that person would not qualify for Medicaid. They're left out. They're in what we would refer to as the healthcare coverage gap. They are low income and are totally left out of Medicaid, and they don't earn enough money to qualify for financial assistance under the Affordable Care Act. And critically, here in North Carolina, professions like home healthcare workers, early childhood educators, cashiers in grocery stores, they are among the professions that have very high rates of uninsured, who are also the working poor. They could benefit greatly from Medicaid expansion. And we know that right now, many of those folks are still working out there during this pandemic and could certainly use this quality comprehensive.
I also want to thank Pisgah Legal Services for hosting this event. My name is Terry Van Dyne, and I represent most of Buncombe County in the state Senate. And I want to start with a little bit of good news, and that is that the federal government, through the CARES Act, has provided coverage for just COVID-19 related testing and treatment. And that's a good thing. But what we have seen with this particular disease is that if you don't have access to healthcare, it sets you up to be at high risk for a serious a serious healthcare crisis if you're exposed to COVID-19. So although I'm grateful for that coverage, it is simply not enough. And that brings me to what's going on in the General Assembly, and particularly in the Senate where I live. What I will tell you is there is nothing going on, and that is so frustrating. So I want to take just a little bit of your time to let you know why this is such an important issue for me. You know, before I became a senator, I volunteered at Pisgah Legal Services. And that is an experience that I bring with me to the Senate every single day. Pisgah focuses on issues that are core to keeping people out of poverty, things like access to income, protection from domestic violence, being safe in your home, and healthcare. And they took on that role because they understand that access to healthcare is fundamental to staying out of poverty. That was one thing I had the privilege, in fact, Jackie trained me to be an ACA navigator. And I will never forget some of the clients that I was sometimes able to help, but sometimes not able to help because we haven't expanded Medicaid. I worked with a construction worker. He needed knee surgery and he would go to work every Monday. But you know, by about Wednesday, he didn't feel confident that he could climb up a ladder. The pain was so intense. And so he wasn't able to work full time. I worked with a young woman who was very proud of the fact that she worked 20 hours a week at Walmart. And she had all her records very well organized. And I could kind of sense that she was dealing with mental health issues. And I couldn't help but think if she had access to healthcare, maybe she could work 32 hours a week or qualify for an even better job at Walmart and have access to healthcare. So, you know, my point is that people can't work if they can't afford to go to the doctor. And for our businesses to thrive, they need access to a healthy, and I might also add, well-educated workforce. So these are investments that we make in our people so that we can all thrive. In his recent book, Indecent Assembly, and he was talking about the North Carolina General Assembly, G. Nickel points out that almost 15%, and this was before COVID-19, 15% of families live in poverty, and 1 in 5 children, in fact, goes to bed hungry. That's not right in North Carolina. It's not good for our businesses and it's not good for us. So why haven't we expanded Medicaid? I think that's a really good question. And one of the responses I hear from my colleagues is that it's too expensive. So I need your help. I need you to write, call, email Senator Berger and Representative Moore. They run things in the House and the Senate, and let them know that this is not acceptable. But I also need you to understand, to really do what we need to do for North Carolina. We need to change this General Assembly, and that means voting in November. We have a governor who vetoed the budget in part because it didn't do Medicaid expansion, and he understands that that is fundamental to getting North Carolina to making us a state that works for everyone. We need to get out the vote for people who will support the issues that we care about. And so I urge you to vote. And I want to thank Jackie again for allowing me the opportunity to say that to you. And I will pass it back to her.
Oh, thank you. Thank you so much, Terry. That was so well said. We appreciate you so much for your leadership and your advocacy on this issue and so many other important issues for people here in our state and right here in Western North Carolina. So just to kind of pull it back to some of the really great points that Senator Van Dyne has made, at Pisgah Legal, when we think about Medicaid expansion as one of our advocacy issues, we see many of those things that she was talking about. First, Medicaid expansion is one of the most effective ways for our community and our state to address and prevent poverty, and particularly at this time when over 12% of our workforce has filed for unemployment claims, and many more are struggling right now today with how they are going to pay their rent. Healthcare coverage through Medicaid, making sure that everybody has this comprehensive coverage, means that we can help reduce medical debt for our low-income families, provide that ongoing and preventive treatment for those chronic health conditions. We can increase access to primary care. Instead of having folks relying on the emergency department, which is the most expensive form of treatment, they are able to get the care they need when they need it and be able to work, as Senator Van Dyne said. When we make sure that everybody has health insurance and can get the care that they need, that reduces the health insurance costs for all of us with lower rates. And we also know that Medicaid expansion will lead to the creation of more jobs here in our communities, which is critically important right now. We also know, and our second point of focus at Pisgah Legal, is that Medicaid expansion supports our rural communities. Both the folks that are living in rural communities, our rural healthcare providers, and our hospitals. It reduces uncompensated healthcare costs, which were over $1 billion annually here in North Carolina. And research shows that other states that have expanded Medicaid have been better able to support their rural communities and their hospitals. We know this is needed out here right now. Third, Medicaid expansion means that people will have access to treatment for a variety of conditions. And as Senator Van Dyne was saying in the story she was telling about being a navigator, that's both for our physical health care as well as our mental health care. Everything that we need is covered. So more people will have access to behavioral health care services, including substance use treatment, which is necessary right here in our community. And finally, COVID-19 has really exposed the many gaps and the inequities in our healthcare system. We've known that they've been there, but from a legal aid provider perspective, what we see in handling poverty law cases every day at Pisgah Legal Services, we know that access to quality, comprehensive care, and it's great that there may be some relief through the Federal CARES Act, but people who can have treatment all the time for all of their healthcare needs, that will help to address poverty. That will make a difference right now, and that will help us as a state and as a community to begin to address those healthcare inequities that we are seeing. Now, before this pandemic, North Carolina ranked 10th in the country for our very high uninsured rate. And that was completely unfortunate and unnecessary. And sadly, that rate is just continuing to get higher right now. We have the ability to provide care to the people who need it most, and our state must act now to provide Medicaid and expand Medicaid to cover all low-income people. So I know all of you out there who are watching this may be thinking, what can you do? And so in addition to what Senator Van Dyne has said, here's my call to action. And it really plays off of some of the things that she has said. Please engage with the community. Write letters to the editor, to all of our local newspapers. Maybe write an op-ed, make the calls, the letters, and the emails to our lawmakers, as Senator Van Dyne suggested. We need to let people know that this is an important issue to us. And along those lines, talk to people about what Medicaid expansion is. There continue to be so many myths out there about what this is, when really it is a critical program. It is the safety net program for our state. And now more than ever, we need it. Share your own healthcare stories. Stories are powerful, and we, of course, all have our own. And sharing those stories can help other people understand and see what this could mean for our state and our communities. And please let people know that Pisgah Legal Services is here to help. All of our services are free. If someone is uninsured, if they need help for basic needs with housing, safety from domestic violence, unemployment matters, consumer or debt law matters, please do contact us. You can reach us locally at 828-253-0406 or online at our website at www.pisgahlegal.org. Please keep informed. You can sign up for email action alerts. We'll keep you posted on this issue as many other issues that we are following at Pisgah Legal, because we are here for the community and we are ready and wanting and able to help everybody who needs us right now. So I would like to thank you very much for joining us. I would especially like to thank Senator Van Dyne for her time and for sharing her expertise and for her service to Western North Carolina as a member of the North Carolina Senate. If you found this information to be helpful and would like to support Pisgah Legal's advocacy work, please consider participating in Giving Tuesday now. It's a global day of giving and unity happening on Tuesday, May the 5th. You can visit our Facebook page right here for ways to get involved. And I just want to again say thank you for joining us. We appreciate you very much. Thank you and goodbye.